I'm Michael Zurenko. I go by Mike. I'm a radiation oncologist. I was born in Cincinnati, Ohio. I moved to Nashville as a small child, spent my formative years in Nashville and then Pittsburgh. I went off to college in upstate New York to study nuclear engineering. The 3 Mile Island accident changed the future of nuclear power in my mind, so I decided medical school was the way to go, and I stayed in upstate New York to go to medical school and residency in Syracuse, New York. I chose radiation oncology because my strength in school was physics and math, and I had an engineering background, and the technical aspects of radiation oncology fascinated me, and it was a way to apply my science and math. My unique skills are that because I have an engineering background, I apply an engineer's mentality to medicine. So I use a practical approach to how I evaluate and manage patients, and the physics of radiation therapy, applies to my background. My style of practice is a combination of evidence-based medicine and common sense. I believe that there's no one-size-fits-all to every patient's problems. I'm also very straightforward. Patients will tell you that. I believe you need to know the truth. I believe that when the news is good, I'm happy to share good news with you. When the news or the situation's not so good, I think you need to know that as a patient so that you can set realistic expectations and make proper decisions for yourself. I don't feel that my job is to tell you what you need to do in terms of treatment, but to help educate you so that you can make the best treatment decisions for yourself. And if I'm not honest with you up front, then you can't make the best decisions. So my practice was Cancer Centers of the Carolinas, and Prisma Health acquired our practice. I had obviously the opportunity to stay with my group practice, which I chose to do. I looked, or considered anyway, not really looked, but considered looking at other places that had prettier facilities and big fancy cancer buildings. But I realized that shiny buildings and pretty waiting rooms don't cure cancer. It's the quality of the people, the quality of the physicians, the nurses, and the staff that cure cancer, and the best there is in Prisma Health. So when I'm not working, I like to play golf. I have a private pilot's license, and I like to fly to weekend destinations. My wife and I scuba dive, and I do woodworking in my spare time. So a piece of advice that I often give to patients when they come in and they're worried about their cancer recurring is that it's okay to be concerned about it, it's okay to think about it, it's okay to plan for that potential eventuality, but worrying about it doesn't help. Worrying about it won't keep your cancer from coming back, and if it never does come back, then you wasted a lot of time worrying about something you didn't need to worry about. And if it is unfortunately going to come back, then you wasted some of your best time worrying about it, but it came back anyway. For patients to make appointments, we're usually by referral, but I'm happy to see anybody for a second opinion or a self-referral. It's easier to get in through your referring physician, your primary care physician or surgeon. But if you call our office at 679-4000, I'd be happy to schedule an appointment with anybody that wants to see me.